Did you know that you could be losing your kidney function and not notice anything at all? That's right. Every day, thousands of people discover by chance that their kidneys are sick. And in many cases, it's too late. They end up connected to a machine to survive. But how can you avoid this? Pay close attention, because today I'm going to tell you the most subtle symptoms of mild kidney failure, how to recognize if your kidneys are intoxifying you, and I'll reveal the secrets to taking care of them completely naturally. Stay until the end, because I'll also show you which habits and foods are destroying your kidneys without you even realizing it, and how to reverse this path before it's too late. Have you ever wondered why so many people end up on hemodialysis if they never had any severe symptoms? Most of my patients never suspected anything was wrong with their kidneys until the damage was already very advanced. 7 out of 10 people I see today in the dialysis clinic had no idea they had kidney failure. They felt no pain, had no fever, or obvious discomfort. One day, a routine test set off all the alarms. And here's the million-dollar question. Is it possible to detect kidney problems on time, even before you feel that something is wrong? The answer is yes. But most people are so focused on asking about cholesterol, sugar, thyroid, blood pressure, they completely forget about their kidneys. However, our kidneys are like the body's silent sewage system. When they stop working, all the toxins build up and start to poison every organ in your body. The problem is that many times the first symptoms are so subtle, so easy to overlook, that months or even years go by before we find the real cause. Today, we're going to break that cycle. I'll show you what those sneaky symptoms of mild kidney failure are, how to interpret your body's signals, how to get ahead of the tests and avoid letting the damage go too far. But also, let's debunk the myth. Taking care of your kidneys doesn't mean taking a bunch of medication. In reality, the best tools to protect yourself are natural, simple, and available to you every day. Are you ready to know which small signs you should watch closely and change your health trajectory forever? Let's get to the point. First, expectations versus reality. Many people think that if the kidney is in trouble, your back or lower back must hurt, or that you will just stop peeing out of the blue, or wake up swollen like a balloon. But the real reality is even quieter. And when the classic symptoms show up, it's usually too late. In fact, early kidney failure almost never hurts. Most pains in that area come from muscle problems, stones, infections, or cysts, not kidney failure. So what should you watch for from early on? Let me tell you, one of the first signs of kidney failure can be getting up 2 or more times each night to urinate. If you are young or an adult under 65, it's normal to get up at most once. More than that, you should wonder why it happens. Of course, there are hundreds of harmless reasons: drinking a lot of fluids before bedtime, taking diuretics, cold weather, having varicose veins, prostate problems, heart or liver issues. However, many times this is the first sign that the kidney is starting to lose function. But here comes the catch. Sometimes the amount of urine does not change, and the kidney problem still advances. Can you have kidney failure and pee perfectly normally, or even more than usual? Yes, this is one of the biggest myths. That's why relying only on how much you pee is a trap. In fact, I know patients with advanced kidney failure who still urinate as always. Let's move on. Another subtle symptom, which filters into your everyday life and nobody associates with the kidney, feeling more tired than usual. Fatigue with no clear cause. Less strength. Even muscle weakness. Have you stopped lifting as much weight or can't endure long walks anymore? Maybe your body is retaining toxins that your kidneys can no longer filter efficiently. The same goes if you start losing muscle mass. Notice yourself thinner without dieting, have a decreased appetite, or unexplained anemia. Because yes, many anemias that are not explained by lack of iron have their origin in a silently growing kidney problem. So why do the kidneys affect so many areas? Precisely because they don't only eliminate toxins, they also produce key hormones. One of them stimulates the bone marrow to produce red blood cells. That's why your energy, your skin, and even your mood can be affected. Even low libido can hide mild kidney failure, but there are more signs to be alert for. If your legs get indented from wearing socks, and at night you still see the marks. If you have swelling in your ankles, feet, hands, eyelids, especially when you wake up, that's called edema. Caution, not all swelling is due to kidney problems, but if it shows up more frequently, don't ignore it. And what about the urine itself? Here's an important fact. The appearance of excessive foam, as if you had poured detergent, is a red flag. It means you're losing protein through your kidneys. And that's never normal. I promise that in just a minute, I'll reveal how to act if you have any of these symptoms. What tests to ask for, I'll give you the exact names, and how to reverse the damage. But first, let me tell you something nobody mentions. Lots and lots of people reach end-stage kidney failure without any symptoms. Suddenly, a CT scan or an ultrasound ordered just in case for something else shows that their kidneys are smaller, there are scars, or they're not filtering well anymore. Imagine the shock. Because then comes the question, can this be reversed? Sometimes yes, often it's possible to slow or in early stages even improve function if detected early. For that, the key is to get ahead before the symptoms are obvious. There is a 5-stage classification for kidney failure, with stage 5 being the most advanced, when toxins flood the body, triggering nausea, vomiting, severe anemia, itching all over, unexplained weight loss, total loss of appetite. And yes, that is when a person ends up in need of dialysis or a transplant. But why do we get to that point? Because nobody did basic preventive checkups. Nobody ordered a simple blood creatinine test or a general urine test. It's that simple. In most cases, these tests let you see the problem at stage 1 or 2 when you can act. If you're over 40, diabetic, hypertensive, obese, on chronic medications, or have a family history, you should already be asking for your annual creatinine test and a simple urine test. If you've already done them and everything is fine, great. If there are abnormalities, it's vital to act quickly. And now I have a surprise for you. The best medicine for your kidneys doesn't come in pills. It's about adopting natural habits without drugs that you can start today. If you want to delay, or even reverse in some cases, kidney damage, the power is in your hands, regardless of your genetics or previous diagnoses. How do you do it? Focus number 1, reduce inflammation in your body. Anything that inflames your body damages your kidneys. Food is your first medicine. Use it as a shield. Want an example? Eating 3 servings of fruits or vegetables of different colors every day radically changes your inflammation status. I especially recommend pomegranate, red fruits like blueberries and grapes, avocado, melon, kiwi, grapefruit, lemon. All these fruits are loaded with powerful antioxidants. Important, if you have advanced kidney failure, always consult before making drastic diet changes, since controlling minerals like potassium is fundamental. But if you're healthy or have mild kidney damage, these foods are your allies. They help control blood pressure, prevent stones, and improve kidney function in general. And there's more. Did you know your gut health has a direct impact on your kidneys? It's true. Eat fruit peels, seeds, whole grains, raw carrot, brown rice, and fermented foods like sauerkraut. All this fiber feeds the good bacteria and decreases systemic inflammation, which protects you from complications. Don't forget the seasonings: turmeric plus black pepper, oregano, garlic, mustard powder. You can even reduce salt and add flavor with these spices. This not only lowers blood pressure, but also detoxifies your kidney filters. Speaking of water, hydration is key. Despite many myths, the recommended guideline is about 30 milliliters per kilogram of weight. If you weigh 75 kg, you should drink about 2.2 liters of water a day. Trouble drinking plain water? Add slices of lemon, mint leaves, or a touch of ginger for flavor and extra benefits. Now we come to one of the most important parts of the talk: habits that destroy your kidneys and you must get rid of now. First serious mistake: holding your urine in for long hours. This increases the risk of urinary tract infections, which can leave scars on the kidneys and lead to chronic damage. Second, a sedentary lifestyle. Spending 8 or more hours a day sitting without moving raises your risk for kidney disease just as much as smoking. Every 2 hours, stand up, walk, stretch, even inside the house. What about your diet? Overusing salt raises your blood pressure, encourages fluid retention, and helps stones form. Cut down on added salt and only use light salt if your doctor recommends it. What about sugar? Hidden sugar in ultra-processed foods, cookies, white breads, cereals, sodas, silently damages the blood vessels feeding the kidneys and accelerates decline. Remember, the worst sugar is the one hidden in foods you wouldn't even guess, so read labels and choose whole and natural foods. And meat? Eating red meat every day can inflame you and overload your kidneys unnecessarily. Science confirms it. Alternate with plant proteins, pasture-raised eggs, and omega-3 rich fish. This way, you give your kidneys a break and reduce future risks. Be careful. Alcohol and tobacco speed up the loss of kidney function, multiply the risk of heart attacks, strokes, and even affect your memory. If you want to protect your kidneys long-term, limit or eliminate these habits. Now let's talk about one of your kidney's worst enemies, medications you may be taking uncontrollably. Anti-inflammatories like ibuprofen, diclofenac, or ketorolac, and inappropriately prescribed antibiotics are frequent causes of acute and chronic kidney damage. Never take these medicines without a prescription, and avoid self-medicating for every pain or cold. Antibiotics should only be used when truly essential, for the shortest period possible, and always with plenty of water. Now, do you want to know what the most overlooked habit for caring for your kidneys is? Your oral health. Gum infections and cavities increase body inflammation and damage the kidneys long term. So yes, seeing the dentist at least once a year is as important as any health checkup. To recap, chronic health problems, from high blood pressure to obesity or diabetes, can be controlled. And in 90% of cases, it's enough to change your daily habits. When was the last time you asked your doctor about your kidneys? Don't just focus on sugar or cholesterol. Include creatinine and urine tests in your routine checkups, and you'll gain years of full life, far from dialysis. Would you like to do for your kidneys what no one ever told you about? It's time to take action. Try this. Spend 3 months adding more antioxidants, more fiber, less salt and sugar, mindful hydration, more movement, and less stress. Then repeat your labs. You'll probably be surprised by the results. Question for the comments. Have you ever felt any of what I mentioned and just disregarded it? Do you have any personal kidney experiences? Tell me, because learning from others' stories saves lives. Remember, your kidneys talk to you, but sometimes they whisper. If you listen to the whispers, you'll avoid the screams. Today, you've unlocked information that can change your life and the lives of those you love. If you liked it, share the video, leave your like, and subscribe to continue learning together. See you soon, and remember, the best investment is your health. See you next time!